Welcome to the Trad Dads Podcast, where we examine cultural and political issues through the lens of traditional thought. All right, so today I want to talk a little bit about the coronavirus or COVID-19 and the panic, the hysteria, the market drop that we've seen over the past couple days. Just to give context, I'm recording this on Monday, March 9th, and this is a bit of a challenge, I think, to talk about this because there's so much that goes into this complex problem. And just at the outset to state, I'm not a physician, I'm not a doctor, I'm not a professional epidemiologist or anything like that, but I do have a PhD in economics, and I've done a lot of statistical work. I've published in journals, and I understand statistics well enough to understand a lot of the issues that are going on here. And I want to talk about kind of some of the economic issues and risk in the way that we're thinking about a lot of this stuff. And there's some high-profile personalities that are really getting a big boost out of this in terms of discussion of risk and that kind of thing. You know, how we know things. There's a lot of that sort of thing going on too in the discussions. And so I want to kind of bring all that together and kind of give my perspective on it. And I think what's going to happen here, I think, is that this is going to come across as sort of big brain centrist kind of thing, which is fine. And there is maybe that's a bad thing. I think it's fine because sometimes the middle is a good place to be, and sometimes when there truly are clowns and jokers to your left and right, you have to just sort of sit there and say what's going on in a measured tone, because sometimes a measured tone makes sense. So again, like I said, I'm not a physician. I'm not a public health expert, whatever that is, but I do understand statistics, and I do understand uncertainty and risk. I'm very interested in those topics, and I've been studying them. So what I want to do is just talk through kind of both ends of this spectrum and why I think there's a good reason to just kind of sit in the middle for now. So first of all, I want to say that, of course, acting like nothing is wrong is bad, right? This is a novel virus, meaning that, we don't really know much about it. We know something about coronaviruses in general, but this is a novel virus. It came from Wuhan, China. I don't know much about the origins of it. I've read over the statistics and stuff like that, and so it's not that there is nothing to worry about. I think the general feeling you get if you look at the death statistics, sort of broken down by age and stuff like that, is that if you're really old or if you have a respiratory condition, there's a reason to worry about this. But that's also true about literally everything, right? I mean, if you're over the age of 70, you're more frail than you were 10 years before that. That's just the way that life is, right? We know the average, age of death is in mid to late 70s for most people in the Western world, right? And, that right there is a point to discuss because we're talking about China. We're talking about Wuhan, China. Now, I don't know, what the GDP per capita is in Wuhan, China, but I'm guessing it's probably lower than it is in other places in China and, and the West. And potentially that a lot of the people that are dying there from this disease are either old or poor or both, right? And so that, that has something to do with it. Access to hospitals or, just general nutrition and all these things, will have an impact on this stuff. So acting like there's nothing wrong is bad. You should take precautions, right? People should be washing their hands. Now, don't overdo it because then you're going to get, dry skin and you're going to expose yourself even more to the thing. But if you're around old people a lot, or if you're around them at all, if you plan to be around them soon, then, you want to minimize your exposure to this thing. And I'm really glad that there's a sort of a big concerted effort to do whatever it is we can at the time that we're sitting in, right? So there's, in some countries, they're working on containment. In other countries, they're working on mitigation. And that's just that's fine, right? If the disease gets there and it surprises you, it's awful hard to contain. But, every country is going to have to deal with this differently. So there is a reason to think that there is a response there. There's a reason to have some kind of concern, right? And there's a reason to, pay attention to how, the people in charge of this sort of thing around you are handling this. If your state health department or your county health department or if the federal government isn't doing enough, then, that's a cause for concern too, right? Because we need, we rely on these people to handle this stuff. And if they're not handling it well, then that's a valid criticism, and it needs to be communicated well. Now, it doesn't need to turn into a full-on crazy panic at all. I mean, there's no reason for that. But there certainly is a reason to be concerned. There certainly is a problem, and hopefully, with research, vaccines, resources put into those types of things, we'll get it handled. And this will always be part of this will always be part of life when you're in your 70s and 80s, right? It's another virus. There are countless viruses none of us know anything about. This will always be a concern if you have a respiratory condition or something like that, or you're just really old. I mean, that's just the way life is. And so, of course, there's no reason to just, it's no big deal. Who cares? But at the same time, you have to understand what's actually happening in front of your face. And so I think what's interesting is that inside of what I just said are several issues that I want to try to pull out. So the first one that I want to talk through is this guy, Nassim Nicholas Taleb. And I think he's an interesting guy because I do remember when his first book, The Black Swan, came out, and he hit it really big. And this is back in the 2008 recession/financial crisis. And, he became very famous. And I distinctly remember I was in an equities class. I was an undergraduate. And the professor was like, well, what are we supposed to do? So he's talking about this book, and, it was a big deal. So he had read it. But his comment was, what's this guy telling us to do? Are we just supposed to rub a Buddha belly? Is that how we're supposed to figure out, how to forecast things? Because essentially the black swan, the idea is that, all your previous data are telling you that all swans are white, and then lo and behold, you go to some new place and you find a black swan, right? So the whole idea is that events that are highly unlikely given the data that you have, but there is some kind of chance of them, and you you don't think that there's enough, you're unable to sort of predict these events, right? Based on the way you're treating the data. And so the problem with this, right? And so to try to make it clear what my professor was trying to say is that, I think you can only beat a model with a better model. Yes, every data analysis is flawed. Every method is flawed. Sure. But just yelling about how models are flawed all the time doesn't get us anywhere, right? So in other words, what we say is you have to beat a model with a better model. So you got a model that has a flaw in it. Okay, well, make a better one. And if, it's perfectly fine to point out the flaws in the model, but at some point, okay, we understand that there are flaws. Thank you for your service. If you want to come up with something better, let us know when you have that, and we'll see if it's better. So that's, I think, part of this thing is that, Taleb has this grift that he gets on where all he does is yell and scream all the time about the evil experts who don't know anything, and they're always telling you they know things and they don't know anything. And so, yeah, okay, we get it, right? Experts don't know as much as they think they do. Fine. What are you adding? Where's the value you're adding at this point? What else are you telling us? You're not telling us anything. Not a damn thing. So if all you're going to say is that, in other words, criticism is fine, but, at some point it needs to be constructive. And the only way for it to be constructive in the context of, models and data is better models or better data. And if you don't have it, then, at some point you have to exit the conversation. So I think that pretty much addresses him. I don't think that his shrieking is really worth talking about more than that. There are a lot of people who super love this guy, who are obsessed with him, or who at least kind of have built most of what they know about risk and economic data and stuff like that around his views. And I'm not saying he's wrong about everything, but he's definitely sort of a perma bear, someone who's just always looking for the next, the next crisis is right around the corner, and so he just gets a huge kick out of that, it seems. And he has a ton of people who really don't know anything but Taleb. They haven't looked at anything else. And so that's, and again, like I said, he's not wrong about everything. And some people are certainly willing to entertain, critiques of the guy. Fine. So what I will say is that, I think that's the other end of the spectrum is you have this, oh, well, nothing's wrong. Don't worry about it. Okay. Well, that's not true. But on the other hand, this is not going to kill 100 million people. I mean, that's just ridiculous. There's no reason to think that that's the case. And I want to point out why that is the case. So Taleb, his whole shtick is this, shrieking about, how bad, fields like epidemiology are, right? Observational data-based, analysis is. But here's the thing, is that sometimes we have better data. We have data that's better than observational epidemiology statistics, which I fully grant, those are terrible. So much of what we think we know about medicine is derived from discussions of, is derived from epidemiology, that's population or observational based. And it's just not, it's not nearly as reliable as you think it is. So, that's totally true. But what's really interesting, and I'm going to link to this article in Slate, which I wouldn't normally link to anything from Slate. But Jeremy Samuel Faust is a Harvard Medical School professor who has put together a short little article that you can read. And the title of it is COVID-19 Isn't as Deadly as We Think. Don't hoard masks and food. Figure out how to help seniors and the immunosuppressed stay healthy. Which, again, is sort of what I was saying before, right? Don't freak out. Don't spend $200 on masks. Just chill out and help old people stay healthy. If you can help them by, paying their heating bill so they can, miss work, if they're sick and they're whatever, right? Do practical stuff that you can handle. Makes total sense to me. And so the story that he tells in here is he says, we get as close as we can get to a controlled experiment with stuff like this. It was the Diamond Princess cruise. And if you remember, I'm not sure when it was during February, but this cruise ship, one person with COVID-19 had been on the ship. And I'm not going to get the statistics totally correct because I'm not going to be able to find it in the article right away, but it'll probably take you 5 or 6 minutes to read this article. So please read it. It's not very long. So this one person shows up, and that person ends up infecting something like 700. Oh, so there it is. 705 people tested positive as of March 4th, is when this article was written. 705 people tested positive for the disease due to that one person who was on the ship. There were 3,711 people on board. Okay, so considering the fact that this is a cruise ship and, everybody's confined and, the air sort of recirculates between the rooms and you can't really stay away from people very easily. Cruise ships are gross. They're dirty. These people, and as he says in here, these people were likely getting a massive dose of this virus. Like they were probably getting reinfected over and over and over on this ship while they were on it. And so here's the thing. So then, this was, I don't know, a few weeks ago, the ship had docked or whatever. So 6 people ended up dying out of 705 people. Now, is that okay? Is that a good thing that 6 people died? No, it's terrible. It's awful that those 6 people died. It shouldn't have happened. In a better world, this disease would not have traveled as it did from China. The Chinese folks would have kept it and they wouldn't have spread it, but they did. But let's also keep our wits about us here. 6 people out of 705 died. All 6 of those people were older than 70 years old. Not a single person on the Diamond Princess under the age of 70 died. Not a single one. And so what that tells you is that if you're in the non-geriatric population, it is very, very low risk for you. And so here's another piece to bring in. So one of the things that you hear from Taleb and, people who read his stuff is they like this concept of Knightian uncertainty. So Knight, as in Frank Knight, who was an economist in the early 20th century. And he was talking about uncertainty in the sense that, there's a risk, which you can kind of measure, right? You can come up with a probability based on past data. But Knightian uncertainty is, the possibility that things can change in the future, and you don't have a way of looking at the past data and measuring the risk of those things happening, right? So that's what Knightian uncertainty is. It just means that, you can use data to an extent, but you can't completely predict everything. So that's true. And what the Taleb and his hangers-on will say is that, well, this this lets us know that none of the data matters, right? We can compile all these statistics, but it doesn't matter. It's a global pandemic. Scream, yell, bathe in Purell every day, never leave your house, right? And all this freak out. It's based on this concept of Knightian uncertainty, right? It's well, we don't actually know. All we have is the previous test statistics. Maybe there's stealth infections and of course, when we're talking about spread, yeah, of course that's a problem, right? I mean, you want to quarantine any kind of problem. Now, I mean, do you literally put a gun in front of people's doors and force them to stay in their house? I don't know, but so there's degrees of enforcement of these things, right? Depending on how bad it is. And it takes wisdom to figure that out. And that's why you have to have the right people in positions of power. So, we don't know how bad this really is, what we're always told. And no matter how much time passes, no matter how much data is collected, no matter how much, how much math we can do with the statistics we have, we are always treated to this discussion about Knightian uncertainty. And this is the Perma-Bear, thesis. The Perma-Bear thesis is there's always a recession lurking around the corner, and I've predicted 100 of the last 2 recessions. So what's interesting about this to me is that actually the uncertainty thing cuts the other direction. So as much as the statistics could understate how dangerous the disease is, it could also overstate it. Okay. And this is addressed in the article that I'm going to link. And essentially what he says is, so if we try to compute a death rate, right, what we do is we take the number of deaths and divide by the total number of people infected, right? Well, the problem is that you have to actually figure out what those numbers are going to be. And since the disease is spreading, then it's likely that both of those numbers are going to change, right? The top number, the number of people that died, and the bottom number, the number of people infected. But the reality is, when you look at a test case like the Diamond Princess cruise ship, you are able to kind of be a little more confident about the data there. And so what's likely to happen is that there's likely a lot of people who are technically infected with this disease, but they don't even know it. Their symptoms aren't even bad enough for them to go to a hospital or to go to a clinic and then go to their local, health office and actually get tested for it. And so again, 90 and uncertainty rears its ugly head, but in the complete opposite direction of the panic mongering, in the complete opposite direction of that, right? We have no idea how many people are infected and are not showing symptoms whatsoever, right? And this is sort of alluded to in some of the statistics, right? Because, influenza, the flu, kills a lot of very, very young people and old people, right? Because their systems aren't ready to handle this, right? Again, I'm not a doctor. I don't know the words for all this. But what's weird with this particular disease is we have no cases of deaths, or very few, in, like babies. And it's like, well, why is that, right? Is it just because of the way the disease works? Sure. Okay, fine. But I got to think there's probably people who aren't showing all of these symptoms. And so they're just not getting counted in that bottom number, right? And so the thing is if that bottom number is understated, right? If the number of cases is actually much, much, much larger, then when you take the existing death rate, which is relatively easy to count, hopefully, right? I mean, you can also be uncertain about that. But I want to say more about that here in a minute. Like, let's say you can get the death rate mostly right. Well, you're going to be far less able to actually count cases of infection without death than you are to count the deaths. It's going to be so much harder to get that bottom number right. And that bottom number could be orders of magnitude larger than you think it is, right? So if, the World Health Organization comes out and says that the death rate is 4% or 3.4% or whatever, it's probably actually a lot lower than that because they don't have data on all the people that are infected. They don't know. So this whole 90 and uncertainty, this whole shrieking that you get from Taleb and his buddies is hilarious because they don't talk about the uncertainty that goes against their panic mongering at all. Sad. The other thing to mention is that with this uncertainty bit is that counting the deaths is not straightforwardly easy, right? And in the article, he uses this term comorbidity, right? So when someone dies of some kind of disease or whatever, which, I mean, this is the thing, right? We have this term, they died of old age. Well, no, they died because they're really old and something attacked their body and killed them, right? A virus, cancer, a bacteria, whatever, right? But if you're old, you're just more likely to die because you're old, right? Your body is compromised, right? You're not able to fight things off. And so, if, we understand this concept of comorbidity very intuitively, right? Because if, comorbidity is just, someone dying of old age. Well, they didn't die of old age. They died of something else. Now, concrete, is there a cause? Sure. Does it really matter that much when they're 85, 90 years old? I don't know. I mean, my grandmother, who was in her late 80s, passed just a couple years ago. My mom died about 6 months ago at the age of 55. So she had cancer. And see, her comorbidity was she had cancer. So they gave her a treatment, chemotherapy. And those two things together massively suppressed her immune system. She got pneumonia and died. So did she die of pneumonia or did she die of cancer? Or did she die of a treatment for cancer? I don't know. I mean, how do you even, right? There's uncertainty there. See, this is that same uncertainty thing. We can't pull out these causes. And so even the top number in our death rates, right? Even that top number is very difficult for us to deal with. Because someone died. Okay, well, what else do we know about that person? Did that person have COPD? Did they have cancer? Did they have some other kind of respiratory condition? COPD is one respiratory condition, but they have some other respiratory condition. Did they have some other condition that, suppressed their immune system somehow, right? Did they happen to get influenza and COVID at the same time, right? So many different things in here, right? And here's all this uncertainty. And yet, in the case of the Diamond Princess cruise ship, we can get rid of a lot of that uncertainty. And so what's interesting is the doctor who's writing this piece says, maybe people that go on cruise ships, they're a little bit more healthy than the general population because they're at least healthy enough to travel, right? Like if you had a horrible fever and your bones were aching and your joints hurt and everything, you probably would just skip going on a cruise, right? Maybe not, right? Because then some people would say, well, I paid too much for me to not, go on this cruise, blah, blah, blah. And those people, so maybe this cruise ship has, in general, people are healthier than the general population. Maybe they're not, right? But the point is the fact that, maybe they're all super healthy, and so that's why only the old people died. Well, maybe, but I mean, even then, it still tells you something about comorbidity, right? You pull the statistics from South Korea, China, whatever. By the way, the South Korea statistics line up very well with the Diamond Princess statistics. It's about the same death rate. Something like 0.8%, and everyone is old. All the deaths are, in South Korea, some of them are in their 60s, but most of them are in their 70s and 80s. In fact, if I'm remembering, 75% of the deaths in South Korea are age 60 or older. 55% are age 70 or older. So, you get an idea about this, different from the one you get when you talk to people who are shrieking about it on the internet. And so, this is a very interesting article to read because he flat out says, the good news is that we have huge advantages to leverage. We already know all of what he had said before, and have learned it quickly. We know how the virus spreads. We know how long people are contagious. We know who the most vulnerable patients are likely to be and where they are. Healthy people who are hoarding food, masks, and hand sanitizer may feel like they are doing the right thing, but all good intentions aside, these actions probably represent misdirected anxieties. When such efforts are not directly in service of protecting the right people, right? Again, very old people or people with, respiratory issues. Not only do they miss the point of everything we've learned so far, they may actually unwittingly be squandering what have suddenly become precious and limited resources. So the point is, if you're healthy and you're 40 years old, you don't need all this stuff. You just need to chill out. Now, if you're around old people all the time, you need to take care of those people and make sure that you don't spread it to them. But that doesn't mean you need to go buy 500 pounds of food and water and bunker down in your house and quit your job and do all this other stupid stuff. So, because again, what's so funny about this is if you take this whole, Talebian uncertainty, fear-mongering, panic seriously, you actually might end up killing more people yourself because you're over here freaking out about a lack of response. You're so mad at the government or whatever. So I think, all of this together, right, shows you that there's this concept of risk and uncertainty that gets applied a certain direction based on what benefits the person who's talking to you. And I'm not saying I have nothing to gain, but I mean, I don't know. I feel like I have plenty of life insurance. If I die from this condition, I think my family will be just fine. But it's just one of these things where there is so much political BS tied up in all these things that if you don't understand the statistics and you're not looking at the data and you don't understand this concept of 90 and uncertainty very well, then you're going to think that everything goes one direction, according to the grifters that are screaming about it, when actually, sometimes the information and the reasoning and the arguments cut against them. So I want to address one last thing real quick, which is the market crash downturn. Last week, stocks got beat up pretty bad. The week before was pretty bad. And this week, or today, the Dow, the S&P 7% drops early this morning, recovered a little bit. And oil prices are way down these last couple weeks. And it's like, well, okay, is the market crash today, COVID-19 and a lack of government responses and it's not contained and oh no, and fear and panic and everything else? Or is it the fact that the Saudis decided to flood the market with oil and not cut their production at all this time so they could push out the shale oil folks. Well, I'm inclined to say both because then I'm covering myself, but I think the reality is it is both, and it's probably the drop today and how bad it was probably more the Saudis than COVID-19. COVID-19 has been kind of priced in to an extent for a couple of weeks, or at least it's been getting priced in for the last couple of weeks. So I'm inclined to think that more of this is the oil issue, today's drop anyway. But the confluence of the two together, I mean, you could have serious market correction, or we've already had a serious market correction, but it could get worse. But again, is your retirement, account taking a huge hit for a while? Is that as bad as a global pandemic that's going to kill 200 million people or whatever the heck these numbers are, 100 million, 84 million people? No, it's not. So stop spreading panic. Stop panicking about it. Stop telling everyone that they should panic. Take care of yourself. Take care of, the people that are susceptible to this thing. And again, I'm not a doctor, right? I'm not a doctor. I'm not a public health professional. I'm just saying this is reasonable stuff, right? But please, for the love of Mike, do not, continue to shriek about this on the internet and get people all worked up. And there is just no reason to do that. Nighty and uncertainty is not a reason to scream and yell about things you don't know anything about. Bottom line. So thanks for joining me. I wanted to, again, just give a little bit of discussion about risk and uncertainty and the things that I know something about, statistics-wise and all of that. So I hope you have a great day. If you want to support the show, consider listening on the podcast platforms. I have an ad that runs at the end that throws a few pennies in whenever you download it. So I appreciate that. There's also, if you want to support me directly, and I do appreciate Rolf, is our sole patron at this point, that Anchor will let you donate through there. I want to address, I did get the message from another person who listens on Anchor. You can leave messages, audio messages on Anchor for me if you want to request something. And he requested that I read, let's see, I don't know if I can read the Latin is beyond me, but it's a document from the Congregation for the Doctrine of the Faith back in 2018. Considerations for an ethical discernment regarding some aspects of the present economic financial system. I was going to talk about that today, but I wanted to get this COVID thing discussed because of this big market drop we had today and the continued sort of spread of this disease across the U.S. But I am going through it, and I am making notes, so I will be getting this other episode on this document out very soon. So appreciate it. Thank you.
Thanks for listening to the Trad Dads podcast. If you enjoyed our show, please subscribe on your favorite podcast app and consider giving us a 5-star rating on iTunes. It really helps us out.